Hello everyone, it's Jamarl Thomas. Welcome to the Progressive Soapbox. So you guys know I was going to get to it. Bernie Sanders. Bernie Sanders. So, universal health care. Bernie Sanders introduced this legislation today. This is RT. Bernie introduces Medicare for all single-payer health care reform. Bernie Sanders. 15 Senate Democrats are now backing a single-payer health care plan that would expand Medicare coverage to a universal health insurance program for all Americans. Senator Bernie Sanders introduced the legislation for all on Wednesday. Medicare for all on Wednesday. In a social media post, Sanders noted that 28 million Americans are still without health insurance and took a swipe at congressional Republicans for attempting to repeal the Affordable Care Act, known as Obamacare. What about taking a swipe at Obama for leaving 28 million people uninsured? I mean, look, this wasn't supposed to go this way, but come on. We are still having a conversation about healthcare. You had a president who took office. He had the wind at his back. The public wanted change. The public was screaming for change, hope, and change. He even put it into his campaign. He gets in office, and with all of this hope, with all of these people thinking that he's going to be this progressive, because that's the way he ran his campaign, this kind of soaring rhetoric of progressivism, he turned around and passed Romneycare. A plan created by vulture capitalists that thought it was perfectly okay to gut companies, saddle them with debt, and take huge amounts of profits in the process. That was the creator of this healthcare plan. It was done by the Heritage Plan, but Romney enacted it in Massachusetts. I'll keep going. I'm just trying to make this point that it's 2017. We had an opportunity to actually do something decent in 2008, and we squandered the opportunity on Obamacare. 28 million people are still uninsured, and when we should be on to other things and talking about other things and having debates about other things, we're still talking about healthcare. Still talking about healthcare. All right, that tangent. If passed, Medicare for All Act of 2017 will replace the current healthcare system with a public system paid for with higher taxes, covering everything from hospital stays, doctor visits, mental health program, dental, vision, and reproductive care, including abortion. Employers will pay higher taxes but will no longer have to cover insurance for workers, and there will still be private insurers for people who wanted elective treatments like plastic surgery. Doctors will be reimbursed by the government. Consumers may have to pay up to $250 out of pocket for prescription drugs with incentives to use generic medications. The bill calls for elimination of premiums for private health insurance, deductibles, and copays. Long-term care will not be included in the bill, but will be covered in separate legislation. All right, so a few points on this. In fact, before I do that, I'm going to let Sanders make his own case. We'll talk about it after.
3, 2, 1. Today in America, 28 million people have no health insurance, and even more are underinsured with high deductibles and high co-payments. Now, my Republican colleagues here in Congress, they had a brilliant idea. And their idea was to throw up to 32 million Americans off of the health insurance they currently have. And what a disaster that would have been. Well, we have a somewhat different idea. And our idea is to do what every other major country on earth is doing, and that is to guarantee health care to all people as a right, not a privilege. And I'm very proud to be introducing a Medicare for All legislation, which now has 15 co-sponsors here in the U.S. Senate and dozens of grassroots organizations behind us. Now, I know that taking on the insurance companies and Wall Street and the drug companies, the medical equipment suppliers, and all those people who profit off our dysfunctional healthcare system is not going to be an easy fight. And the only way we win this is when the American people stand up as they are and demand real change. And when we do that, you're going to see major and beautiful things happening. So I ask you to work with us at the grassroots level. Speak to your neighbors, speak to your coworkers. Let us go forward and finally do what this country should have done a long time ago, and that is to guarantee health care to all people. Look forward to working with you. Thank you.
Straightforward to the point. Straightforward to the point. All right, so let's talk about it. Let's talk about the politics. So right off the bat, this is dead on arrival. There is zero chance of this going anywhere. Donald Trump is not going to sign Medicare for all any more than Obama was going to kill Obamacare. Not happening. The second point, Bernie Sanders understands that it's not going anywhere. He's a bright man. I'm pretty sure he full well understands that Donald Trump is not going to sign his bill. He's doing it because he wants to put these people on the record. So think of it from the standpoint of, make the assumption that Donald Trump is going to lose in 2020. He's an immensely unpopular president. I suspect that popularity is only going to get worse. If Democrats run a ham sandwich, then they have a pretty good chance of winning. If Democrats run some kind of corporate tool, then no, they're probably going to lose. Regardless of what Trump is, the public sees through it. Now, assume for the moment that they win. You have all these people who are on record saying, yes, we're for healthcare. Yes, we're for healthcare. Yes, we're for healthcare. Once you're on record, can you imagine the fallout if those guys turn around and say, I know I said I was on record when I was out of power, but now that I'm in power, now we have the capacity to do something about it, I'm now voting no. So I suspect a lot of this, for Sanders' standpoint, is getting these guys on record, putting their name on it. Yes, I'm for healthcare. No, this is no chance of passing right now, but at least the person is on record for it. That's the first point. Oh, well, that's the second point. Now, the third point has to do with the reasoning of the people for signing on to this. You had people like Kamala Harris, if I'm not mistaken, Cory Booker, people who weren't necessarily for healthcare before, all of a sudden are saying, hey, we're for healthcare. We're for single-payer healthcare. I'll put my name down with Bernie Sanders. Sure, I'll do that. Many of these people have this idea of running for presidency. So I don't necessarily think it's a leap of logic to say that part and parcel to them putting their name on the line in this case is, if they want to run, they understand that a large section of the population will not vote for them unless they sign on to it. It may not necessarily be a litmus test from the overt standpoint, but it is a litmus test. And I'm pretty sure they understand that it is a litmus test, particularly if you're running for president. You don't get 15 million people leaving your party. Hillary Clinton lost that election. She lost it. What's the hope of these guys winning the election if you have a large share of the population that is against them on principle? I'm pretty sure they're signing on to this because they have to. I'd make the point that that doesn't matter. I don't think it matters. Politics is not about this person having this kind of joyous feeling of doing something. I don't care what's in these people's heart on this point. What I care about is getting it done. So yes, if there's a certain amount of political will that puts pressure on people to move a particular way, then good. You get pitchforks or you get dollars. In this case, they understand they're pitchforks. The second point on this is, Sanders is the most popular senator in the country. Part of the reason why they're so willing to sign on to this is because they want to leverage Sanders' popular... Jesus Christ, that's a hard one. Sally sells seashells at the seashore. They want to leverage Sanders' popularity to increase their own. Think of it from the standpoint of, this guy is the most popular senator in this country, or the most popular politician in America. I am signing my name on the line with that particular popular guy. And everyone who looks at this bill and hears this big splashy announcement that Bernie Sanders is releasing Medicare for all, my name is going to be right there beside Bernie Sanders. all of those people were yelling at progressives saying, hey, I don't understand why you don't like Kamala Harris. She's perfectly nice. I would say look at Lee Camp's video on Kamala Harris. The point on this, though, is they're trying to create this kind of bridge to get those people back. And they believe that part of the way of getting there is signing on to universal health care. This is, yeah, they're trying to, it's like they're trying to rub themselves in progressivism, but it's somewhat of a shallow version of progressivism. They believe that this is their conduit to the left. The left, look, I don't know if the left is going to buy it or not. The conversation, there's a meta-narrative that's taking place here. In fact, in all of these elections, there's a meta-narrative that's taking place. Regardless of the campaigns that these people run, ultimately what you have is a conversation between the rich and everybody else. Top 1% and everybody else. The political apparatus in the United States is wholly owned by people with means. Those people with means give money to politicians. Those politicians need large amounts of money to get elected. And you have people of means who just so happen to have that cash. If the politician wants to continue to get that money, they're going to do, or at the very least, lean in a certain direction. The conversation, the meta conversation that's being had is between the rich and everyone else. The politician is a go-between. It's the conduit between those two things. That politician is making a case of, I need you guys to support me for universal health care because I can't get those people without it. Now, the conversation they're trying to have to everyone else is, hey, universal health care, this is what I'm on the board for. You should vote for me because I am trying to get universal health care and I'm going to be in your corner. They're not in your corner. It has nothing to do with that. It's everything to do with what they can sell to the people who are giving them cash and still get that cash. Understand, people's power base matters. Like, so Bernie Sanders, his power base was for the most part the people who gave him $220 million. Because his power base are essentially the American public, he has this huge amount of latitude to behave in ways that these other guys would never behave. They can't behave that way because they're beholden to the people who are giving them the money. If they behave in a particular way, if they behave in the way that Sanders behaved during the campaign, not talking about when he was a sheepdog, talking about before he was a sheepdog, they wouldn't get the cash. They wouldn't get the cash. There's a great conversation between Chris Hayes with Tom Perez and Bernie Sanders sitting on a couch. And Chris Hayes kind of makes this point like, Tom, do you feel the same way about this as Sanders? Sanders goes into this thing about the billionaires are on that back and you got to fight the plutocrats and all this stuff. Tom Perez is like, I think this is a false choice, Chris. Tom Perez can't have that conversation. He can't have it. So Sanders can. If a Democrat wants to continue to get a huge amount of cash from those people, if they can assuage the people who are their donors, what they're trying to assuage them with is, yes, we need to pass this because otherwise I can't get elected. If you want me in that office and if you want me to get elected, then yes, I need to be able to pass this. If you don't give me the cash and allow me to do this, then I can't get elected and your interests can't be served. This is a meta-narrative, man. This is a meta-conversation. Now, the question becomes, will they be able to sell this to the voters? Are the voters going to believe that single-payer health care is enough to warrant a vote for a Democrat? Are the people who are paying them, the people of means, are they going to be okay with Democrats pushing for Medicare for all? I suspect yes. I also suspect that, and yes for the second part, yes, the millionaires, the billionaires, the donors, they will be okay with this. They don't have a choice. That Democrat is not going to be able to get elected without it. And I think at a certain point, those Democrats understand that. The society you want is society, or the society you get is the one you think you deserve. period. The moment that Americans get to the point of saying, wait a minute, healthcare should be a universal right, then healthcare will be a universal right. They wouldn't be able to get elected without it. You have a litmus test. This litmus test didn't exist before. Understand where we started off. Then this is the last point. We started off at a place where, when Obama was taking office, wouldn't even bring up single-payer healthcare. You could barely get him to bring up a public option. And even though he did when he took office, that immediately went away, and they instituted a mandate forcing American citizens to buy a private product or private service, health insurance. We're at the point right now where this is not just on the table for debate. I would argue that this is going to be the prevailing debate. This is going to be a litmus test. Whether they want to own up to this being a litmus test is kind of besides the point. None of these politicians would have signed on to this bill if they thought they had to, or if they believed they didn't have to. I don't care what's in their heart. What I care about is these guys coming around saying, okay. Yes, fine, I'll sign on to your healthcare bill. You shouldn't have to twist Democrats' arm for healthcare. If this is the left-leaning party, and you have to twist the left-leaning party's arm, that's not a left-leaning party. I don't care what they call themselves. It's not a left-leaning party. He has to push and cajole these guys to get them to actually back something that should be built into the DNA of the party itself. I know people are going to criticize Sanders. And yes, like I said before, there's no chance for this bill to pass. From the perspective of Sanders, I'd imagine that to him, all of this stuff is politics. And I would imagine to him, look, he's not a radical. He's not a radical. He's a functionary. He believes in changing, like changes. But he believes that he has to go through this typical political process to do it. I don't care if he calls for a political revolution. He may want things to change, but no, he's not going to take the steps to get those things to actually change. At least not in a dramatic way. This is probably going to be as dramatic as you're going to get from Bernie Sanders. I would say, though, you have to give him credit where credit is due. You went from a country that couldn't imagine having any sort of health care to debating the merits of single payer. And not just the merits. I am predicting that they will come around. They're not going to have a choice. So, alright guys, if you enjoy the content, feel free to share, subscribe, and of course, you can always support the work through Patreon. Thank you.